When I first came to Miriam, it was like the day that I walked into my church, it was just warm and compassionate. The PET scan had shown it already spread from the esophagus and the stomach into my lung and my liver. But I never felt any fear. I always felt like I was in good hands. After 2 years, the doctor said, "You made it. You're cancer-free. You're in remission."
There's a certain pride to being a Miriam Hospital nurse. When I speak of the Miriam Hospital, people think of bricks and mortar. I think of it as a culture.
We were founded 100 years ago, but the legacy of the hospital lives on in the people here.
These aren't just patients. These are our friends, our family, our community members, and we want to make sure we take care of them the best that we possibly can.
We've built a reputation that's outstanding, and a lot of patients want to come to see us. Our emergency department sees between 70 and 80,000 patients a year. That's bigger than some of the Boston hospitals that have 3 times the inpatient beds that we have.
When I started here back in 2014, we would get emails and it'd say, "We hit 170 patients today. It was a really, really busy day." Our busiest day now is over 280 patients.
We not only serve people in the community, people with insurance, people without insurance, people without primary care doctors. We're bursting at the seams.
We have a group of patients called Left Without Being Seen. These are patients who wait a long time and ultimately get so frustrated with their wait times they walk out. I really worry that we're not providing care the way we really want to provide it. I want to provide that wonderful experience for all our patients, and we simply don't have enough space to do that.
It is absolutely unsustainable. We need help. The Miriam Hospital was actually founded by a group of women whose sons and husbands were not allowed to practice at some of the other hospitals in Rhode Island because of their ethnicity. And so these women went from door to door with little coin boxes to collect funds for the very first hospital.
Being a Jewish hospital is ingrained in our culture and our mission.
I was always involved with the Miriam because it was important to my family. My father was one of the founders. It was important for him to make sure that we understood that what he was doing for the community was important enough to support.
And that mission statement has never changed since the first day they opened the hospital.
Here we are at the precipice of essential critical growth, and we need that again.
This campaign is the largest campaign that the Miriam has ever undertaken by an awful lot. Miriam's never done a $125 million project before. It needs it. The community's entitled to have a facility like this, as are all the patients who come here. It's a vital part of our operation.
The imagining of this new building is really as much for the patients of our community as well as it is for our staff, who really deserve to work in an environment that's conducive to them providing the exceptional care that they're known for. The staff need this space, they need room to sit down at the side of the bed and talk to patients.
This is a special place. If you do get sick or have a problem, you should hope that a place like this exists to take care of you.
I'm here for something. I hope this is a part of it. I hope this is a part where I'm carrying on the legacy of this hospital.
I would encourage everyone to really consider the power of philanthropy dollars, what it does, what it serves. We believe in the Miriam. We know it needs to be here for centuries to come.
The Miriam has been there for us. We need to be there for the Miriam.